Imagine walking into a doctor's clinic a decade from now. No clipboard, no waiting room overflowing with paper forms, no frantic attempts to remember what happened 3 months ago, no guessing about how well you slept last week or whether your body is recovering properly after a hard month. Instead, your doctor already has an informed starting point, not because they're psychic, not because artificial intelligence has replaced human judgment, but because your biology has been quietly telling a story every single day. A story captured by unobtrusive wearables, periodic blood testing, and intelligent systems that spot patterns long before symptoms demand attention. Welcome to the Future Clinic, a place where smart rings, advanced blood biomarkers, and human medical expertise work together, and where healthcare shifts from reacting to problems toward predicting them. For most of human history, medicine has been reactive. You feel unwell, symptoms appear, you see a doctor, a diagnosis follows, and treatment begins. Modern medicine has saved countless lives, but that reactive model has an inherent limit. It usually starts after the problem has already taken hold. Consider how many major conditions begin quietly. High blood pressure can progress in silence. Type 2 diabetes develops gradually, often undetected for years. Heart disease can smolder long before pain signals alert us. Sleep disorders, chronic stress, metabolic imbalances, and low-grade inflammation frequently start with subtle changes that go unnoticed. The body whispers. We typically only listen when it starts shouting. Now imagine a different approach. Instead of waiting for symptoms to arrive, we continuously monitor physiology, sleep quality, heart rate variability, HRV, resting heart rate, respiratory rate, small changes in skin or core temperature, daily activity patterns, and recovery trends. Pair that with periodic blood biomarkers, glucose, insulin, cholesterol fractions, inflammatory markers, hormones, markers of liver and kidney function, and micronutrient levels. Together, these data form a living biological dashboard, a real-time, multi-dimensional snapshot of your health. Wearable technology is central to this vision. 10 years ago, most wearables simply counted steps or recorded occasional heart rate snapshots. That was impressive then. Today, the hardware and sensors have become far more sophisticated and subtle. Imagine a ring you wear every day. Lightweight, unobtrusive, that continuously observes your physiological rhythms without interrupting your life. It watches how you sleep, the timing and architecture of sleep stages, how often you wake, and how restorative your sleep is. It tracks your nervous system through HRV and subtle shifts in resting heart rate. It senses recovery trends after training or stressful weeks. The ring doesn't diagnose, it quietly collects clues. Blood testing remains one of medicine's most powerful tools. A lab draw reveals the biochemical story happening beneath the skin. Sugars and insulin dynamics, cholesterol and lipid patterns, inflammatory signals, hormonal rhythms, organ function, and nutritional status. The problem has always been timing. Most people get blood tests once a year, maybe twice. That's like trying to understand a film from two still photographs. Valuable, but incomplete. Annual tests miss the daily ebb and flow of physiology. The sleep debt accrued over months, the cumulative impact of stress, the metabolic fluctuations across seasons. This is where wearables and biomarkers become complementary. Your periodic blood work interprets internal biochemistry. Your wearable explains the daily behavior and physiology that drive those lab results. Combined, they reveal a much richer story than either could alone. Add artificial intelligence into the mix and the possibilities become practical rather than merely theoretical. AI excels at pattern recognition. Not by replacing clinicians, but by processing enormous amounts of data and highlighting meaningful trends that humans could easily miss. Imagine your wearable has detected 3 weeks of worsening recovery scores, falling HRV, declining sleep quality, a creeping rise in resting heart rate, yet you feel mostly fine. An AI model trained on millions of prior cases flags that combination as an early warning signal. It doesn't diagnose or alarm, it simply suggests that this pattern deserves attention. A human doctor then reviews the context. Recent life events, medication changes, training load, dietary shifts, and blood work, and together you decide on the next step. This distinction is important. Many people fear that AI will replace doctors. I don't believe that's the most likely outcome. Medicine is deeply human work. Patients need empathy, clinical judgment, context, communication, and trust. These human qualities can't be replicated by algorithms. Rather than replacing clinicians, AI is an extraordinary assistant, a tool that can sift through complex datasets, surface patterns, and free clinicians to focus on interpretation, shared decision-making, and compassionate care. Picture a consultation 10 years from now. You don't have to say, I think I've been sleeping okay, or I feel more stressed than usual. You arrive with a clear, data-informed narrative. Your wearable shows 2 months of fragmented deep sleep and declining HRV. Your blood work shows slight rises in fasting glucose and inflammatory markers. Your activity log indicates reduced recovery after workouts. Instead of relying on vague recall, the conversation becomes focused and efficient. Together, you and your doctor review the trends, discuss possible causes, perhaps a seasoning of life stress, a nutritional gap, or insufficient recovery between workouts, and create a targeted plan to reduce risk and restore balance. Prevention is where this integrated model truly shines. Healthcare systems historically prioritize treatment. Treatment is essential, but prevention is often far more effective and usually less costly. Preventing type 2 diabetes is far easier than managing full-blown diabetes. Preventing burnout saves years of suffering. Catching cardiovascular risk early spares catastrophic events later. The biggest challenge has always been early detection, recognizing meaningful deviations before disease takes root. Wearables and biomarkers won't predict the future perfectly, but they can reveal early warning signs. Persistent low-grade inflammation, metabolic instability, chronic sympathetic nervous system activation, signals that often appear years before a disease diagnosis. Think of the patient experience. You wake up and glance at a recovery score that summarizes last night's sleep, HRV, and readiness for the day. Periodic blood testing, scheduled when clinically useful, perhaps more frequently for people with known risk, provides biochemical depth. AI synthesizes those inputs with your medical history and population-level evidence, then highlights trends for your physician to review. Decisions become proactive rather than reactive. Adjust sleep hygiene, tweak nutrition, modify training load, or investigate further with targeted tests. That's health intelligence, turning raw data into meaningful understanding and better decisions. Most people don't need more numbers. They need better interpretation. They need context. What does a change in HRV mean for my life? How do my cholesterol numbers relate to my daily habits and family history? How will a small change today influence my health 5 years from now? The Future Clinic aims to answer those questions not by producing more charts, but by delivering clearer narratives and actionable guidance. At OXYZEN, this vision is at the heart of what we do. Not building another gadget, but building understanding. Our goal is to help people see the connections between sleep, stress, recovery, metabolism, and long-term health. Health is not a set of isolated measurements. It's a network of interconnected systems. When you view biology as a network, patterns emerge that single snapshots cannot reveal. Will this future eliminate disease? No. Human biology is complex, and uncertainty will always remain. Medicine will always require judgment and individualized care. But earlier awareness creates opportunity. The chance to intervene sooner, to alter trajectories, and to prevent problems from escalating. Imagine detecting a metabolic shift 5 years earlier, restoring restorative sleep before chronic fatigue sets in, or improving recovery habits before persistent burnout. Those opportunities add up to enormous potential benefits at both the individual and population level. If there's one message to take away, the future of healthcare is not any single technology in isolation. It isn't AI alone, blood tests alone, wearables alone, or doctors alone. The future is integration. AI, wearables, biomarkers, and human expertise working together, each contributing what it does best. The clinic of the future may not start when you fall ill. It may begin while you are well, quietly observing, learning, and guiding, helping you make better choices long before disease appears. That may be one of the most important transformations in medical history. I'm Dr. Yende. Thank you for joining me for another episode of OXYZEN Health Intelligence. Remember, the future of medicine isn't just treating disease, it's understanding biology before disease begins. That future may be closer than you think. I'll see you in the next episode.